Working disabled healthcare programs from California's Medi-Cal. Hello, I am Kevin Canals with InsureMeKevin.com, an independent health insurance agent. And Medi-Cal has two programs targeted at individuals who are disabled and continue to work. Now, as a health insurance agent, I do not enroll people into these plans. But I do work with individuals and families, and it is good to understand your options for reducing healthcare expenses. Because, if you're on a fixed budget like a lot of us, then, you need some extra cash for rent and food and transportation and other healthcare expenses. So the first program that Medi-Cal offers is called the Qualified Disabled and Working Individual. And this is tied to the Medicare Savings Program. And Medicare Savings Program is designed to help people with original Medicare. And Medi-Cal will cover the premiums for original Medicare, Part A or Part B, and sometimes cover the costs of original Medicare. So this is kind of tied into the Medicare system, and one of the conditions is that you had original Medicare Part A at one time, possibly because of the disability or illness, and you lost Part A, possibly because your income went up and you no longer qualified. You must continue to have that disability, that disabling impairment. You must have limited resources. For an individual, $4,000 in assets, $6,000 for a couple. Not eligible for Medicaid or Medi-Cal. That means you're not eligible for other low or no cost Medi-Cal programs like the Modified Adjusted Gross Income program. Expanded Medi-Cal through Covered California, because your income is too high, you don't qualify for that. And have an income in 2024 on a monthly level for a single adult less than $5,020. If you are married, you and your spouse can have up to $6,816 monthly. So if you meet all the conditions and criteria, Medi-Cal will cover the cost of original Medicare Part A, which is expensive. It can be over $500 per month, and that's the hospital insurance. The second program is the 250% Working Disabled program, and that 250% refers to the income level relative to the federal poverty level. So this is geared towards people who are, making money. They don't qualify for the Medicare, and that 250% poverty level, that changes every year. In January, the federal government comes out with the new numbers, and you must meet the definition of being disabled, the federal definition, and engaged in income producing activity. So, it might be self-employment. You may be working part-time for a company and you're not eligible for the health insurance through that company because you're less than 20 hours, you're doing self-employment, but you are generating some income and you're not eligible for, other programs. And here is the key to this program, as I see it, is that you must be eligible for supplemental security income if it weren't for the fact that you have a job and that you're earning income. So your income is too high. So for a single adult, you must make less than $3,138 per month. That would be 250% of the federal poverty level for a single individual in 2024. And again, those numbers will go up. And then you can gain Medi-Cal with no cost health insurance and coverage for healthcare expenses and medications. Now, some people will say, well, why don't you just go for a Covered California health plan with the subsidies? And that may work for some people, but let's look at the cost, because if your income is less than 138% of the federal poverty level for the household size, you would be Medi-Cal eligible, Magi Medi-Cal. But of course, you're working, other people in the household, your spouse may be working. So let's look at the costs for a 40-year-old single adult that is making right at 250% of the federal poverty level, which is $37,656 annually. And let's look at the least expensive Silver 70 health plans that person would be eligible for. So in Sacramento County, the least expensive Silver 70 plan would be the Aetna CVS Health. And after the subsidy of $389, the monthly premium is $120. Not bad, but you know, that's still a chunk of change. Los Angeles County, LA Care is the least expensive Silver 70 HMO. After a subsidy of $249, the monthly premium is $107. And then in San Francisco County, Anthem Blue Cross EPO is the least expensive silver plan. After a subsidy of $471, the monthly premium is $132. So that's, you know, over $100 per month going out on health insurance. Okay, then you have the cost sharing. With the Silver 70, the office visits are $50, specialist visit $90, lab tests $50, x-rays $95, images $325, and there is a medical deductible if you're hospitalized. If you are an inpatient in a hospital, you must move through $5,400. Then you go into co-insurance of 30%. So that's more. That's a lot of money. The prescription drugs. Now the generics are going to be $19, but the other drugs are going to be subject to a $150 pharmacy deductible. So you have to spend $150 on those tiers, and then you get the lower copay for like the tier 2 preferred drugs at $60 per month. Tier 3 non-preferred brand name at $90, and Tier 4 specialty drugs at 20%. So those costs can really add up, especially if you do have a disability and you're still working through, you know, maybe surgeries and other prosthetics and things like that to get everything situated. But of course, you're still working. You know, you're trying. The whole point is to be healthy and sustainable. And the 250% working disabled program recognizes your desire to be a sustainable individual. But of course, health insurance and healthcare costs are expensive, so that's why they've developed this program. So again, I can't enroll people into these programs. You need to contact the county. Now, don't say I make too much money. Don't give me a reason why you're ineligible, because we really don't know. If you're right there on the borderline, apply. The income calculations are kind of complicated in terms of what is considered, what is reduced, the deductions. So at least apply. And then you may be declined. Okay, well, then you know you don't qualify, but at least attempt it. At least put in that application if you think you're right there on the borderline, and see if you do qualify, and that would help reduce your healthcare expenses, drugs, and stretch the budget a little bit further. If you have any comments or questions, you may leave those down below. I'll do my best to answer them. This is kind of complicated when it gets to Medi-Cal, but I'll do my best. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.